Hi friends, welcome back to Complete Medical Coding, a complete CPC learning channel. Today, let's learn few guidelines of evaluation and management codes. It's a very important chapter from the CPT codebook. So let's have a look into it. So let's learn about the E&M codes. What is the series of E&M codes? The series ranges from 992012 to 99499. Now, what do you mean by new and established patient? This is before beginning with the E&M series, you need to know what is new and established, new patient and an established patient, as everybody knows. Anyway, let's look into the decision tree for the new and established patients. This is the decision tree. Received any professional service from the physician or another physician in group of same specialty within last 3 years. If it is a same specialty, yes or no. If it is no, the patient is visiting for the first time, it's a new patient. If it is yes, is it the exact same specialty? Yes or no? If it is no, again new patient. If it is yes, again, is it the exact same subspecialty? Again yes and no. Yes or no? If it is no, new patient. If it is yes, established patient. So it means patient has visited the same doctor, the same specialty, same subspecialty, then it will be an established patient. If the patient has visited the same specialty, same subspecialty doctor before. Here it's talking about the last 3 years. If it is no, it's a new patient. These 3 years and all mentioned here, it's a general term, but it will vary according to when you will move on to insurance companies, that will vary. Okay, this is just a medically related. This is the procedure for the new and established patients. Now, which are the levels of E&M services? Which are the main levels? There are 7 different levels: history, examination, medical decision making, counseling, coordination of care, nature of presenting problem, and time. Among these, history, examination, and decision making, the first 3: history, examination, and decision making, medical decision making. These are the key components in selecting a level of E&M service. The next 3 components, that is counseling, coordination of care, and nature of presenting problem, are considered contributory factors in the majority of encounters. And last one, time, it's not a descriptive component for emergency department levels of E&M services. For emergency department level, it's not a descriptive component, otherwise it is also necessary. Now, the main 3 components we have to taken care, like history, examination, and complexity of medical decision making. If it is history, it can be problem focused, expanded problem focused, detailed, or comprehensive. Examination also same, can be problem focused, expanded problem focused, detailed, or comprehensive. If it's a decision making complexity level, it can be straightforward, low complexity, moderate complexity, or high complexity. So these are the 3 key components that we need to check during coding for the E&M codes. Let's look into one by one in detail. First one, the history. How will you determine the extent of history performed? 4 things are there, right? Problem focused, expanded problem focused, detailed, and comprehensive. If it is how will you identify if it is a problem focused? In problem focused history, there will be a chief complaint and brief history of present illness. If it is expanded problem focused, chief complaint, brief history of present illness, and problem pertinent system review. Means a small description about the problem review. Okay. Third one, detailed. Chief complaint, extended history of present illness, Problem pertinent system review extended to include a review of a limited number of additional systems like pertinent past, family or social history directly related to patient problems. Pertinent past history, not complete, but a brief past, family or social history. If it is a comprehensive history, then then these all will be included. Chief complaint, extended history of present illness, review of systems that is directly related to patient problems, a complete past, family or social history. If all these things are included, then it will be a comprehensive history. Now determine the extent of examination performed. For the examination performed, also same 4 factors. Under problem focused, it can be limited examination of the affected body area or the organ system. Limited examination. If it is an expanded problem focused, then it will be limited examination of affected body area or organ system and other symptomatic or related organ system. If anything, any other related symptoms also will be identified. Detailed, an extended examination of the affected body area and other symptomatic related organ system. Extended, if it's an extended examination, then it will be detailed. Comprehensive means a complete examination of a single organ system. Complete examination. Okay, that can be considered as a screening also. Now, the third factor, decision making. So, first is history, second is examination, and third one is decision making. What is the level of complexity of medical decision making? See, in this chart, you can identify that here it is showing the medical decision making can be of 4 types: straightforward, low complexity, moderate complexity, and high complexity. What can be considered if it is a straightforward decision making? The number of diagnosis or management options, number of diagnosis will be minimal. Amount or complexity of data to be reviewed should be minimal or none. Risk of complications, morbidity is also minimal. If everything is minimal, we will consider it as a straightforward medical decision making. If it is low complexity means number of diagnosis is limited, amount or data to be reviewed is limited, and the risk is low, then low complexity. For moderate complexity, number of diagnosis will be multiple diagnosis will be there, data to be reviewed will be moderate, few data needs to be reviewed, and the risk also will be moderate. What if it is high complexity? So it will be an extensive number of diagnoses, will be extensive. Amount of or complexity of data to be reviewed is also extensive, and the risk factor will be high. Then we will use high complexity decision making code. This is how you need to code for the E&M codes. E&M codes you will identify, you will learn it more easily only through practice questions. So here I will be discussing few practice questions, and then we'll be coming back with more questions in the upcoming sessions. So let's discuss few practice questions. The first question: Mary, a new patient, was seen in the physician's office for abdominal pain. The physician performs a detailed history and a detailed examination. Medical decision making is of low complexity. What will be the code? So for coding E&M codes, you can directly from the question itself you will identify if it is an office visit or emergency department or critical care, preventive measure, whatever it is. So here it is. This is a new patient, and it performs in the physician's office. So it's an office visit. So you can directly take the E&M code. Anyway, it's in the beginning of the CPT code book, and you need to go to the office visit code. So if you take office visit code, what is mentioned here? Detailed history, detailed examination, and low complexity medical decision making. So it is directly there in the code 99203. Detailed history, detailed examination, and medical decision making is of low complexity. So answer will be 99203. Next question. Brian, a 15-year-old patient with rectal bleeding, was seen in the office of a gastroenterologist. The patient's PCP represents primary care physician. Okay. So the patient's primary care physician requested that the gastroenterologist provide advice about this case. The specialist concluded a comprehensive history and examination and complexity of medical decision making was high. The consultant documented his findings and communicated them via a written report to the PCP. What will be the code? So this will be definitely a new patient to the gastroenterologist, right? Because the primary care physician, patient's primary care physician has been referred to a gastroenterologist. So that will be the first time. So the codes will be from the new patient codes, office visit codes. So you need to go to the office visit codes. What are the findings? Comprehensive history and comprehensive examination. Comprehensive history, comprehensive examination, medical decision making was high. These three are there in code 99205. Okay, so the answer is 99205. Next question. Adam, an established patient with hypertension, visits a physician's office for a blood pressure check. The nurse performs the service under the physician's supervision. What will be the code? So this is an established patient office visit code. So go to office visit established patient. And who performs the blood pressure checkup? Only the patient has came for the blood pressure checkup. So the nurse has performed the BP checkup under physician supervision. So if you go to the first code in under established patient, 99211, office or other outpatient visit for random of an established patient that may not require the presence of a physician or other qualified healthcare professional. Usually the presenting problems are minimal. Typically 5 minutes are spent performing or supervising these services. Yes. Here it's clearly mentioned physician is not required. So here the physician has not done anything. Only the nurse has done the BP checkup. So the answer will be 99211. Okay. Next question. Dr. James provides critical care services in the emergency department for a patient in respiratory failure and with congestive heart failure. Ventilator management is initiated. Dr. James spends an hour and 10 minutes providing critical care for this patient. What will be the code? So this is critical care service, right? So you need to go to the critical care service page. You need to take critical care service page. So in that it's mentioned the Dr. James spends an hour and 10 minutes. So if you go to critical care management and management code, the starting is 99291. There it's mentioned critically ill or critically injured patient for first 30 to 74 minutes. You need to code 99291. So here how many minutes the doctor has spent? An hour and 10 minutes. So it means 70 minutes. 70 minutes fall under this code category. 99291. So the answer will be 99291. If the question is like Dr. James spends an hour and for example say 15 minutes. So what will be the total time? It will be 60 plus 15, 75. So you need to code 99291 and one add-on code also. The next code. See each additional 30 minutes. Each additional 30 minutes you need to code 99292. So answer will be 99291 and 99292. If the question was an hour and 15 minutes. Okay. Next question. Joby provides preventive medicine services to an established 45-year-old patient who is in good health and has no complaints. Dr. Joby obtains a comprehensive history, performs a comprehensive examination and counsels the patient on proper diet and exercise. So this is a code related to preventive medicine. So you need to go to the preventive medicine codes. You need to take preventive medicine codes. So in that you can see this is an established patient. That's also mentioned there. So go to preventive medicine and take established patient. The starting is from 99391. The first code in the CPT code book. Periodic comprehensive preventive medicine evaluation, re-evaluation and management of an individual including an age and gender appropriate history examination counseling risk factor reduction interventions, and ordering of lab diagnostic procedures for an established patient infant age younger than 1 year. So 99391 code represents 20 medicine services for less than 1 year. But here the age is 45 year. So look below, just check where is this 45-year-old, which code represents 45-year-old. It is 99396, 40 to 64 years. So the answer will be 99396. Okay, so here the age is the main factor. The rest everything will be same. If it is either new or established patient, and then you need to look for the age. Okay, so this is how you need to, in general, you need to code for the E&M codes. Let's discuss few more mock questions. I'll be coming back with the mock questions from E&M sessions very soon. So stay tuned for more videos. So friends, these are few important guidelines and practice questions from the E&M chapter. Hope you understand, and if there is any comments, you can always mention it in the comment box. And let's discuss few more questions from E&M series in the upcoming sessions. So stay tuned for more videos. And thank you so much for supporting me. If you are new to the channel, please subscribe to my channel. Thank you so much. Bye.